Dive into the world of medicine with the Patient's Guide podcast, where we simplify the science and uncover the research behind medical topics.
All right, so get this. You go in for surgery, right? And you come out taller.
Yeah, sounds a little hard to believe.
But it's actually what some researchers are finding.
It's pretty wild, actually.
We're diving into a new study today all about adult spinal deformity surgery.
Okay.
And we're calling it ASD for short. Millions of adults are dealing with this.
Yeah, and it can really impact their lives.
So here's the thing that blew my mind. 74% of patients in this study who had corrective surgery for ASD, they actually got taller afterwards. We're talking an average of 7.6 centimeters.
That's almost 3 inches. Huge difference, both physically and I'd imagine mentally as well.
So let's break this down a little bit. Who are these patients?
The study looked at almost 200 adults, and they're mostly women. The average age was about 57, and they had a bunch of different types of spinal deformities. We're talking scoliosis, which is that sideways curvature of the spine, kyphosis, sometimes called hunchback.
We're not just talking about one specific condition here. It's a whole spectrum.
Exactly.
And these surgeries, we're not talking about a quick little procedure here.
These are serious surgeries. We're talking spinal fusion, where they're actually permanently connecting vertebrae.
Wow. Major surgery. And we know that on average there was this height gain, like we said, 7.6 centimeters. Was that even throughout the body? Or was it concentrated in a specific area?
That's a great question. The biggest height gain they saw, it was all in the trunk.
The trunk.
Yep, exactly.
It's straightening out.
The spine is straightening, and that's where you see the biggest change.
Makes sense.
To get a little technical, the study looked at T1 to S1s. That's basically from the top of your back to the bottom.
Okay.
They also saw some height gain in the lower extremities.
Lower extremities? So wait, you mean like legs?
Exactly.
So are you saying like the bones in your legs are getting longer?
No, it's not that the bones themselves are actually growing. What seems to be happening is the surgery changes how your body compensates for the spinal deformity. Think of it this way. If you had a building, right, and it was leaning to one side,
Okay, yeah.
it would look shorter than it actually is.
Right. This surgery is basically straightening that building.
So our bodies, we hunch over to make up for a spine that's out of whack.
So we end up masking our true height.
Like our bodies have this hidden height.
In a way, the study calls it unmasking of hidden height. And once the spine is straightened out, the body doesn't have to work so hard to compensate.
Oh, that's so cool.
Right.
It makes you think.
Imagine the impact, especially for someone who's maybe struggled with height loss for years because of ASD.
And this study found a direct correlation between how much they were able to correct the scoliosis and how much height the patient gained in their torso.
So the straighter the spine, the taller the person.
Yeah, pretty much.
Wow. Okay, so can surgeons predict how much height someone might gain? Is that possible?
That's the goal. The researchers actually came up with these equations to try and predict height gain based on the surgical plan for each patient, being able to tell a patient, hey, not only will this surgery help your pain, help you move better, but we also think you might gain a couple inches.
Yeah.
It's a big deal, both medically and, I think, psychologically.
Especially in our culture, where height is such a thing.
Oh, yeah.
Speaking of the psychological side of things, didn't the study also look at how these height gains affected people's mental well-being?
They did, yeah. So they used these questionnaires to assess patients' self-image, mood, all that.
Okay, so how they felt about their bodies, which, let's be real, can be a sensitive topic.
For sure. And one of the questionnaires they used was this thing called the SRS-22R appearance questionnaire. But basically, it measures how people feel about how their back looks.
Got it. And what did they find anything?
Here's the thing. They found that the more height someone gained in their trunk, the better they scored on that self-image questionnaire.
So it's not just about the physical change, it's how that change makes you feel.
Exactly.
So actually standing taller can make you feel better about yourself.
It seems that way. Yeah.
We always hear, stand up straight, you'll feel better.
Exactly. They looked at that connection between height and mood.
Okay, for mood, they use something called the Promise Depression Questionnaire.
Yeah.
Another catchy name.
They love those questionnaires.
What'd they find out about this whole height depression thing?
This is where it gets really interesting. They found these correlations between specific types of height gain, like in the torso, and how people scored on the mood questionnaire.
Hold on, so correcting the spine, gaining height, could actually, improve someone's mood.
That's what the research suggests. Although, important to remember, correlation doesn't equal causation. More research, all that.
Oh, for sure. But still, I mean, come on, what a connection.
It's huge.
It really makes you think about how connected our bodies and our minds are.
Absolutely.
If our physical state can influence our mood, that's a game changer for treatment, for prevention.
Totally. And this isn't just about ASD. This is about everyone.
Spinal health, baby.
We were talking about how our bodies are always adapting, always trying to keep us upright and balanced.
Like my insole situation.
Exactly. But all that compensating, it takes a toll. This study is like a huge vote for paying attention to our spinal health.
Yeah.
Good posture, catching problems early, even just thinking about how we move.
It's a good reminder for all of us.
Mm-hmm.
It's mostly from the spine decompressing, the body relaxing.
Yeah. And maybe even more importantly, those height gains. They seem to be linked to feeling better about yourself, feeling more confident, and potentially even being happier.
It's wild. It really shows you how connected everything is. Our bodies are amazing, man. I'm going to leave everyone with this thought. If something as basic as standing taller can have these crazy effects, what else are we missing?
What else is out there?
That's something to think about. And to everyone listening, thanks for joining us. We'll catch you next time. Until then, stay curious.
If you enjoyed this episode of The Patient's Guide, you can find more below.